Hi, I'm Michael Scarpone, physician and director of Trinity Sports Medicine. We've started a balance lab recently after acquiring some equipment for concussions and then have expanded into the arena of balance. Why is that important? It is important because many times people have balance issues and fall issues that can be prevented. And the fall issues can lead to ER admissions and surgeries for fractured hips or other body parts. And this can be deleterious to the patient and their health, but also increases cost for patients and the healthcare system. So by diagnosing balance disorders earlier, we hope to be able to rehab them and prevent falls and other issues that come with the falls. So the importance of the balance program is the heart of prevention and preventive medicine. Obviously, once you have a fall and you break a bone, and hopefully it's something that can be handled with a cast, but sometimes it requires significant surgical intervention and maybe even several surgeries to help correct the problem. This leads to a lot of time off of work, time away from activities and family, and also can mean a decrease in your health status, as we know that fractured hips in elderly people can lead to pneumonias and even death in a number of cases. So preventing these problems is paramount, and I think at this point in time with the technology that has become available and it is now here at Trinity, we can help diagnose early on people at risk for falls and then helping them to prevent them through rehabilitation and other processes. So one of the important things that we hold here at Trinity is the relationship between the primary care physician and their patients. So our goal is to aid them in caring for their patients and giving them cutting-edge information to help them better meet their patients' needs medically. And through that, we developed a wellness program in conjunction with our therapist and our nurse practitioner to screen people for balance disorders, which could include cardiac issues, obviously musculoskeletal issues like knee arthritis or back problems, including even dizziness with inner ear problems. So all these things can cause problems with balance and falls. And sometimes in the primary care offices, they're very busy and they're taking care of the diabetes and a lot of the other major issues. This allows them to have somewhere to send that patient for a thorough investigation with cutting-edge equipment, and then that information would go back to them so they can make the appropriate decisions for their patients as they would do with any testing. So our goal is to help the primary care physicians in our area take the best care of their patients, especially in the fall prevention arena. So one of the benefits that Trinity has is they have a multi-specialty system with not only cutting-edge equipment, but physicians quite capable of handling all the various balance problems and where they come from. In other words, some may be better served by an ENT specialist, some may be better served by neurology. We have a physical medicine and rehab specialist, Dr. Swaby, who specializes in inpatient balanced issues, especially from head trauma or strokes. In some of the more severe cases, he can handle those inpatient. So if someone would come into the ER, depending on the severity of the problem, it could be as simple as referring them back to their home health provider and encompassing balance programs in their therapy at home, or coming to our center here as an outpatient for more advanced therapies, or going to the rehab floor or one of our skilled floors where Dr. Swaby and some of the other inpatient specialists can take care of you to get that problem as best as it can be and then get you out to the outpatient setting for further treatment. So Trinity does have the gamut of care, not only from the equipment point of view, but from the specialty point of view too. So the spectrum of care can include all the way from the inpatient setting all the way to the outpatient and wellness setting. Here in conjunction with the YMCA, we have been able to provide fall prevention courses and exercises for the general community in a wellness program to sustain or to help people who don't have to go through a huge balance testing and program, just need some help. And so we have the whole spectrum from the more severe illnesses all the way to a wellness program here in the community setting. Just remember, like any program, there's screenings, and there's a yearly screening, just like you get screenings for colon cancer and you get screenings for other health-related issues. Balance and vestibular problems can be, and even cognitive problems can be screened for every year, and if caught early can be treated very effectively versus waiting until it gets really bad and you do end up more in an emergency room setting or have more problems that are harder to solve. So a yearly checkup and balance testing to see if there's deficits coming, since we'll have testing data from the year before and the year before, and now we can trend this data to see if there's any declines in function that we should be aware of. So balance screening is important because there are many factors that can contribute to balance and falls. This could be anything from inner ear infections or ear infections, sinus infections. All of these things can cause vestibular dizziness type problems or vertigo and cause falls. These kind of problems become more common, especially with inner ear problems as we age and we get little stones in our inner ear ducts and they get clogged, and physical therapy maneuvers can help clear those quite effectively. Other issues are some of the medications that we're taking. Some of the side effects could be dizziness or feeling of fogginess or sleepiness, which can also contribute to falls, especially if one is taking a nap or sleeping and then wake up in a drug state that allows them not to be aware of their surroundings quickly, and then they get up and they fall. Or they can cause what we call orthostatic blood pressure problems, where their blood pressure drops from a medication they're on or other cardiac condition, and they get up and they basically black out and fall. So those are a number of things that we can do. Then it can help, and again, bringing in a multi-specialist that all can help us to, once we know what the problem is, getting the proper treatment and fix for it. Also, there's musculoskeletal issues with arthritis and leg stiffness, leg weakness, back problems. Also, diabetic neuropathy is a big problem in our area, where we have a lot of people that have nerve damage from their diabetes. And one of the things I tell patients all the time is that we balance from our different senses. And what are our senses that help us balance? Well, obviously our ears are our balance center. And if there's a problem with our ears, that's one area of our senses that are not working properly. The next is our vision. We see the area. And a lot of times you have an ear problem, your vision can compensate. And then the last thing is sensory. In other words, we feel our feet on the ground, we feel our body moving through the air or across a floor or across the grass, and we feel unevenness. Well, with neuropathy, you can lose that ability. So a lot of times, say in the evening, it's dark, you get up, you can't feel the floor with your feet, your eyes are out of the picture because it's dark, so now all you have to rely on is your ear sense, and that may not be enough to keep you upright. So all these things play together to create what we call balance or steadiness, and I think it's a multifactorial thing, and again, the goal is to bring all these things to bear to help prevent falls and achieve a better lifestyle.